Hello and welcome.
Jeez, stop. Hi, my name is Kelley. I'm with Southern New Hampshire University and I'm doing the physical assessment. This is my patient. Can you state your name and date of birth?
Hello, my name is Alibozek, 7/10/89.
Thank you.
Let us begin.
Alright, can you tell me where you are?
I'm home.
Okay. Can you tell me today's date?
Today is the 15th of February.
Alright, the month,
The
the year. Thank you.
It's 2019.
Good. Alright. So patient is alert to person, place, and time. First I'm going to start off this examination with examining the patient's head. So we're just going to take a look at the patient's shape of the head. So it is round, symmetrical. Looking at the hair growth, it is evenly distributed, symmetrical, brown in color. There's no lacerations, no masses with palpation, no bumps, bruising. Next, I'm going to inspect the patient's eyes. So I'm going to just have you close your eyes. I'm going to palpate around the patient's eyelid and below. There is no masses with palpation, no bumps, bruising, any tenderness with palpation.
None to be noted.
Nothing hurt, okay. Next I'm going to inspect the patient's lymph nodes. So I'm going to start on his top of his head, work my way down, come up around the ear, bottom of the ears, down the neck, up under the chin, clavicular lymph nodes, and axillary lymph nodes. Lymph nodes are not palpated. The next I'm going to palpate the patient's frontal and maxillary sinuses. No masses noted, lumps or bumps. Any tenderness on palpation?
None.
No tenderness to palpation.
Nope.
Okay. Next I'm going to check the patient's mandibular joint. So I'm going to come up to the patient's jaw. I'm going to have the patient open his mouth wide. Good. Close. Again. Good. No clicking noted with palpation. Any tenderness?
None.
Okay.
My mandibular joint feels excellent.
All right, great. Next, I'm going to inspect the patient's neck. Neck and muscles look symmetrical. Trachea is midline. I'm going to inspect the patient's thyroid. So I'm just going to have you kind of pivot a little bit towards the camera. And I'm going to inspect the thyroid from posterior. I'm just going to press to one side. I'm going to have the patient swallow. Good. And again. Good. Thyroid noted on palpation was swallowing, but other than that, normal. I'm going to have you sit, come around this way again. Thank you.
You're welcome.
I'm going to have you open your mouth, stick out your tongue, move your tongue up and down, side to side. Good. Stick out your tongue again for me. Tongue is midline, pink in color, normal secretions. Let me just see your teeth, smile. Good. Dentation is normal. Looks good. You're brushing your teeth. Good. Good job.
All 3 times a day. Religiously.
Good. I am going to inspect the patient's eyes. So the sclera is white, no redness noted, no drainage. The cornea is normal. I'm going to inspect the patient's eyes a little bit more. So I'm going to have the patient follow my pen light with his eyes. Just your eyes, not your head. Good. So equal symmetrical coordination. Good, all within normal limits. I'm next going to check the patient's peripheral vision, so I'm just going to have you close one, put a hand over one eye. Good. And tell me what, how many fingers I'm holding up in your periphery.
1, 2, 2,
You got it.
2,
Okay. Place your hand. Good.
1, 2, 1, 2.
Good. Okay. Within normal limits with peripheral vision. Next, I'm going to check the patient's pupillary response. You can take your hand down, sir. Thank you. Bright light in your eye. Good. Okay, pupils are equal, reactive and round to light and accommodation. I would give them a size 2. The next thing I'm going to have you do is stick out your tongue and go, ah.
Ah.
Good. I would also check the patient's gag reflex. By doing that, I would take a tongue depressor and take a long Q-tip, and I would sweep the back of the patient's throat, and hopefully would get a proper gag reflex with doing that. Next, we're going to take, this would be my ophthalmoscope. I'm going to look into the patient's, close into the patient's eye. I would notice that there would be a positive red light effect to the eye, and the retina is within normal limits, and we're going to do the same to the other eye, positive red light reflex, and retina is normal. Next, I'm going to inspect the patient's outer ear. Both ears are symmetrical. The outer ear, there's no masses, lumps, or bumps noted. Color is the same, equally distributed to the ears. With my otoscope, I'm going to check the patient's inner ear. Inner ear canal is within normal limits. There is little to no cerumen buildup. The eardrum is gray, pearly gray in color, so that would be within normal limits. Ear canal within normal limits, no cerumen buildup, and eardrum is pearly gray. Next, if I were to have a tuning fork, I would do the Weber and Rhine test, but I do not have that right now. To do the Rhine test, I would take the tuning fork, I would strike the tuning fork, and I would place it behind on the mastoid, on the posterior mastoid of the patient's ear. I would have him lift up a hand when he would tell me when the noise stopped, and then I would take the tuning fork again, strike it, place it in front of the ear, and again he would lift his hand up and tell me when he stopped hearing the noise. The Weber test, I would take my tuning fork, I would strike it, I would place it on top of the patient's head. I would instruct the patient to tell me when he would stop hearing the noise. Hopefully it would be symmetrical in both ears, and not one before the other, and that would be a hearing deficit if he did. Next, I'm going to do the whisper test. Can you tell me what you heard?
Pear.
Okay.
Reggie.
Good. Bear and Reggie. Maybe a little slight deficit on the right. And I think that would be all for the HEENT portion. We're moving on to cardiac. Get HENT. Moving on to cardiac, we're just going to inspect the patient's jugular vein distension. Sitting at a 90-degree angle, there's no jugular vein distension noted. If there was, his veins would be bulging. Next, I'm going to palpate pulses. So first, I'm going to actually start with his carotid pulses, temporal. Equal and symmetrical in strength, 2+. Good. No bruise noted. Next, I'm going to inspect the patient's carotid. So you just do one side at a time. Good, equal strength, they seem symmetrical, 2+. Good, no bruise noted. So I checked your pulses. We're gonna check your axillary. Axillary brachial. Axillary and brachial are both 2+. Radial. Good, equal strength, 2+. I'm just gonna have you lay down. We're gonna check the patient's femoral pulses. Equal, 2+. Popliteal. Equal, 2+. Posterior tib. Equal, 2+, and pedal pulses. Equal and 2+. Good. I'm just going to have you remain laying down. I'm going to listen to your renal arteries. Iliac. And femoral. Good. No bruise noted. And I'm also going to listen to your aorta. Good. Can I have you lay on your left side? And I'm just going to inspect the patient's PMI. Good. All right. I'm just going to have you, actually you can remain on your back. You can listen to the patient's heart. A lot of work, huh? So I'm going to listen to heart sounds S1, S2, Erb's point, tricuspid, mitral, pulmonic, and aortic sounds. we would want to check again with the bell of our stethoscope for any abnormal heart sounds. Okay, good. I just want to check also for any edema. No edema noted. No swelling. I'm just going to have you straighten out your legs. Thank you. Further check for any edema, but there is no swelling or edema noted. I'm also going to check for capillary refill, so I'm just going to have you give me your hands. Checking for capillary refill, we would want to press down on the patient's nail beds. We would want skin color to come back in 2 seconds or less, which it is. He's within normal limits. Good. And within normal limits on patient's lower extremities as well. All his skin is warm, dry to touch. And I'm going to have you sit up now. And I think we can move on to our pulmonary section.
How would you like me oriented?
Sitting on the side, please.
Okay.
Okay. So first I want to inspect, I'm going to have you turn towards the camera.
Yeah, help you assist me.
Thank you.
Oh, thank you.
I'm just going to have you say 99.
99.
And again.
99.
Good. And come back around. I'm going to have you inspect the patient's diaphragm and how the patient's lungs expand when he breathes. Take a deep breath. Good. Out. Good. With palpation, his diaphragm expands and contracts normally and symmetrical and is symmetrical. I'm just going to take a listen to the patient's lungs, but you would want to note skin color also with pulmonary. Orally, his skin is pink, ears are pink, nail beds are pink, and extremities are warm and pink. Also for oxygenation, you would want to check for a pulse ox. We do not have that today. You would place that on the patient's finger, and it would take a reading of his blood oxygen saturation. We would hope for a 95 and above on room air. Also that we would want to do is use an incentive spirometer. You would have the patient close his lips around the machine. He would inhale, take a deep breath in. He would want to see the ball or piston, whatever the machine has, rise to the top with inhalation. You would want the patient to hold inhalation as long as possible, keep the ball up as long as possible. So that would give us a good identification on how well the patient can inhale and breathe. And is also good to prevent pneumonia in the hospital. I am going to listen to the patient's lungs. I'm going to have you take a deep breath in and out. Out. In. Good. Out. In. Out. In. in, out. Good. Lung sounds are clear throughout anteriorly. No wheezing noted, no rhonchi, clear. If you don't mind just facing the camera a little bit, I'm going to listen to your posterior.
I was gonna sneeze.
Okay. Alright, try to straighten out a little bit. Thank you. Nice deep breath in, out, in, out, in, out, in, out, in, out, in, out. Good. You can stay right there. I'm just going to percuss. So I'm just going to have you, if you can, sit up straight and try to just leave your arms kind of resting at your side. No dullness heard, sounds resonate in all areas, and I'll percuss, steer back. And posterior, I think I forgot to mention too, posterior lungs are clear throughout, no wheezing, rhonchi noted. And with percussing, sounds resonate, no dullness noted. I want to say we can move on to GI now. I'm going to listen to your bowel sounds. But first I want to inspect your abdomen. Abdomen is flat. That's fine. Abdomen is flat. I'm going to, symmetrical in size, just with visual and light touch. There's no masses or lumps or bumps noted. I'm going to listen to his bowel sounds. I'm going to start in the right lower quadrant and work my way up to the right upper, left upper, and left lower. Bowel sounds are very active. I would call them normal active, close to hyperactive. I'm going to percuss his abdomen in a zigzag form. We want to percuss good. No dullness, sounds resonate throughout. And just with some light palpation. Any tenderness with light palpation?
No, ma'am.
Okay. I was not able to feel his kidney, liver, or spleen with light palpation, which we would hope not to. If we were to do some deep palpation, I would have the patient inhale deeply and then exhale. When the patient would exhale, I would press a little harder with deep palpation, and you would be able to feel the kidney, liver, possibly the spleen with deep palpation. Any bowel movement today?
About 3 of them.
Okay. I'm going to have you sit up if you don't mind. And I'm just going to check for any tenderness in the back here, if you don't mind. Again, facing the camera, tilting a little bit. CBM tenderness.
That's right.
Any tenderness? Tenderness on that side? No?
None.
Okay. We're going to move on to the musculoskeletal
Excellent.
portion. So I'm just gonna have you sit up on the side of the bed again.
Okay.
Looking forward to it.
So first I'm just gonna check the patient's joints. So we're gonna go from top to bottom. Gonna have you kind of move your neck around. Good. Shoulders. Gonna do some range of motion. Elbows. Move your elbows a little bit. Wrists. Fingers. Good. Can you give me a good squeeze? Okay. Knees and ankles, toes. Good. Any inflammation is not noted in any of the patient's joints. They seem to move fluidly. All right. So now I'm going to inspect the patient's neck. I'm going to have you put your head front and back. No, front and back. Okay, that's as far as you've been. Okay, and side to side. No, look. Okay, and tilt. Okay. With the following directions, the patient seems to flex, has good flexion and extension, rotation of the neck, adduction, abduction of the neck. Just testing strength. Push against my hand. Push against my hand. Good. Okay. Strength is equal and full strength.
Oh yeah.
Shoulders. Just with range of motion, can you pull your arms out? And that's abduction and adduction. Place them in. Good. So symmetrical and equal with that movement. You can relax. We're going to test strength. So press up against my hands with your shoulders. Good. Okay. Next we're going to do your arms. So I'm going to have you place your arms up above your head. If you can go as far back as you can. And then kind of, good. And then out again. All right, good. Good range of motion with patient's arms. I'm going to have you put your arms down at your side. And then I just press against my hands. Push in. Good. Okay. Next, elbows. If you can do flexion and extension. Good. And then strength. Push up. Good. And then go back to flexion and push against me. Good. All right. Good equal strength and good flexion and extension. Also, we should internally rotate. Here, good, and then externally rotate. Good. Wrists. Flexion and extension. And strength. Press against me. And up. Good. So good equal strength, good flexion and extension, internally rotate and externally rotate. Good. And next I'm going to have you stand up. All right, we're going to test your back. You can stay like that. So you're going to bend forward, bend back, as far as you can, side, other side, good. And then, so good, flexion and extension, tilting side to side, he's symmetrical. Can you twist just with your back, not your hips? And, yep, not with your hips, just your back. Okay, good, and the other way. All right, good. And good rotation. Equal strength. Next, hips. So you're going to flex your hips outward. So take your leg and kind of flex your hip out and bring your hip in across you. Good. And just going to test your strength. So bring your hip out. Okay, you can do the other side. And out. Okay. Good. And symmetrical with movements and equal strength throughout. You can sit down. Thank you.
Thank you.
Next is the knees. So if we can do flexion and extension with your knees, so bring your legs up and back. Good. And for strength, push against me. All right. Ankles, flex and point your toes. Good. And internally rotate and externally rotate. Good. Okay. Symmetrical equal movements and normal strength in all areas. So next I'm going to have you stand up, and I'm going to have you, if you can just kind of walk down this aisle way here.
This aisle?
Yep.
Okay.
And turn around and go back towards the lamp. Good, and then walk on your toes. Backwards, all right, and forwards. And on your heels. Good. All right, you can go back. You can go back and sit down.
Okay, thank you.
Next, no, sit up.
Oh.
What are you doing?
It was a long day.
Alright, next we're going to do deep tendon reflexes. If I had the proper instrument, I would use it, but we would check your brachial, so kind of just stay a little bit relaxed. Okay. And then patellar and ankles. Okay. I'm going to have you take your finger and touch your nose. Good, and with the other hand. Good. And then can you just alternate? This would be rapid movement testing. Good. And then if whatever's easier, if you want to lay down or if you can do this staying seated, you would take your heel and drag it down to your ankle.
Where do I start with my heel, man?
On your knee.
Okay, so.
Okay, and do the opposite leg.
Is that what you're looking for?
Yeah, okay.
Excellent.
Good job. Next, I'm just going to have you let's check facial movements. So I'm going to have you open and close your eyes tight and close them. And eyebrows up and down. And tongue out. And move it up, down. And smile. Good. Okay. I would probably also want to check a Snellen eye chart. I unfortunately don't have a Snellen eye chart with me, but if I did, it would have lines of letters. Starting from the top, the letters would be large. Going down to the bottom, they would get smaller. I would have the patient stand from 20 feet away. I would have him close one of his eyes, and his acuity would be the line that he could read the furthest.
Just to let you know, I have outstanding vision.
Good. 20/20 vision. Okay. I'm also going to check for sensory of his face. So I'm just going to have you close your eyes. And I just want you to tell me if you feel a sharp or soft touch.
Oh.
Is it sharp or soft?
Can you do it again? Ouch.
Okay.
That's sharp. That is very soft.
Okay.
Ouch, that's sharp.
Come on.
That's soft.
Okay. I also just want to check the rest of his extremities as well as his face. So keep your eyes closed.
Ouch, sharp. That's soft. That's soft. That was sharp.
Okay.
That's soft. Ouch, that's sharp. Ow. Sharp. That's soft. Ow. Sharp. Soft. Sharp. Soft.
Okay, good. Thank you.
Can I open my eyes?
You can open your eyes.
Both of them?
Yes.
Okay. What was your weapon of choice? Oh, alright.
Next, I'm just gonna check some memory things, and then we will almost be finishing up. So, I would like to have you count backwards from 100 by sevens.
What?
It's not a joke.
Okay, 193? Oh my god, all the way down?
Yeah.
Oh boy. 84? 77, 70, 63, 54, 47, 40,
there.
yeah, thank you. Oh boy. 33, 26, 19, 12, 5, -2.
Okay. You passed.
Thank you.
I'm going to have you. Oh, I'm just gonna get my piece of paper.
Pizza.
Pizza paper. This is just gonna check for. Well, let's do it first. So, take this piece of paper, fold it in half, and place it on the floor.
You want it the long way or the short way?
Just the long way.
Okay, long.
No.
You said the long way.
Okay, good. So that is checking the patient's comprehension, which he comprehended, and he followed directions.
You pick it up.
So next, I'm going to tell you this is going to be memory, so I'm going to give you 4 words. You have to remember these words, and then count backwards from 100 by 20s, and then tell me the words again, okay? So let's see. We'll do truck, bear, tree, house. And
Okay.
then count backwards from 100 by 20.
180, 60, 40, 20, 0. Truck, bear, tree, house.
Good job. All right. At the beginning, the patient had told me that he is alert and oriented. He let it
be known.
We tested that he was alert and oriented times 3, which he was. I'm gonna have you close your eyes. Close your eyes, and I'm gonna take your hand. I just want you to tell me what letter I'm writing on your hand.
Okay. O. C.
C.
Okay.
Good. Okay. Keep your eyes closed. Tell me what object is in your hand.
This is a paper clip.
Good. Okay. And keep your eyes closed. And the hand out.
Oh. This is a cotton ball.
Okay. Good job. Can you tell me how you celebrated your last birthday?
Well, let's see. I believe I had cake with my beautiful wife and son.
Okay. All right. And I think that is all. I want to thank you for being my patient. Thank you for watching. I think we have completed everything on in this assessment.